Is there an echo?
A little bit of an echo. Oh,
Tiny
wait.
bit.
No, it's good now.
Good?
I think we're good. Dr. Anoia, how we doing?
Great. I'm doing well. How are you doing?
I'm great. I'm great.
Yeah.
Glad to be on here with you finally.
Oh,
We
you
planned
were
this like a
working
month or two
too?
ago.
Yeah. I see you with the scrubs. I changed my shirt. I was like, all right, let me change my shirt. But I have my scrubs on. I have my scrubs on. I did,
Yeah,
yeah.
it's all good. But I mean, this will be going on the Long Island Dentist podcast. I think episode number 7 now. But
Okay,
yeah.
yeah, yeah. No, I've been checking them out. I've been checking them out. And I gotta admit something. I haven't done podcasts. I gotta get into that. Oh, so this is my first looking and really being on one.
Nice.
Yeah, yeah.
Good. Well, I'm glad we got this started. We broke the seal.
Yeah, my aunt is really into it. I have an aunt like really into podcasts and her daughter. So I probably should get a little more into
Really?
it.
What is she also in dentistry?
She's actually optometrist. Her and my uncle graduated from Penn State. They wanted me to do optometry, but I used to work for him sometimes, like in the summers, I'd go and just like see how it is and things like this. But I just wasn't into it, you know. In the back of my
Yeah.
mind, I knew it was there, but it wasn't really something that I thought I would enjoy doing. And my aunt complains a lot about it.
Does she really?
A
Because I
little
thought.
bit, she was only working about 3 days a week, but I guess it's tough because you give advice and patients don't necessarily listen, you know. Maybe they don't take their contacts out and then they keep coming in with like red eye or whatever's happening. But I think
Oh,
that it drove her a little crazy, that the patients just weren't listening. But
I
it's part
mean,
of it, right?
we know exactly what she's talking about, right?
Yeah, no, exactly. Absolutely. But
So
no,
it's
yeah.
the same thing for us.
So how's it going in Melville?
It's going good. It's going
Yeah.
good. I really like seeing when your name comes across on the referral card because I'm like, oh yeah, no, we're talking. We got to do a podcast, and the patient's like, you guys are on a podcast? What? And it comes up all the time. I'm like, yeah, we are. We're doing it
We
next
are. We're
week.
doing it right now. That's what's going on right now. Yeah, no, the patients, we have a mix, right? We have a mix of patients, and there's definitely a niche on Long Island where they just don't take insurance, and we're just really thankful to you guys for helping us out, I know right now, like some of my patients go to Staten Island for root canals because there's just nobody here. I mean,
That's a
there's a couple
far
guys
away.
here, Yeah, there's a couple guys, but it's like a 3 month wait. The tooth will probably be gone by the time you know, it's
Three
tough.
months. No, that's a long
Yeah,
time for the root canal.
yeah,
That needs to be done
I
like right
know.
now.
Yeah,
So
yeah. And I do them. I do root canals. I do about 20 a month, but it's
wow.
still, yeah, it's still not enough to satisfy the quota of like how many people need them. Yeah.
Right, right. That's a lot. What about Apicos?
You know what? I only did it in residency. I only did a couple APICOs in residency. Other than that, no, I don't do them. I don't,
No.
maybe
Oh, okay.
one, no, two actually, two in 16 years. I did do.
Oh,
I
so
wish I had the
you're
follow up.
familiar though. Yeah.
Yeah, no. I always enjoyed the surgery part. I mean, when I was in Lake George when I first started for about 5 years, right near Great Escape. If you ever been up there, it's right near there, and it was a
Yeah.
DSO, and I don't know, there's like maybe 16 rooms. I mean, it was a huge place. Every specialty, they had there, and I think that's really where I got, a lot of experience with other docs and not just being by myself.
Yeah.
I find now these young docs are just by themselves. Like some, they're getting hired like maybe first year out, and I don't know, maybe at least on Long Island. I don't know about everywhere else, but I know on Long Island the new docs are having a hard time kind of getting their foot in with other places because they don't do molar root canal.
Mm.
Like I had one girl, she said they won't hire her until she really gets the molar root canal down pat. But they had hired her part time, and I guess was waiting for her to kind of feel more comfortable with it.
Is that really a requirement? Like, do you have to do molar endo? I mean, what do we have endodontists for?
Only exactly. I feel like it's only for probably certain offices don't want to refer out. They want to keep that in. I know for me it does bring about 200,000 a year in just doing molar endo. That's not even premolar or anterior. So I think they want to keep that money as much as they can. But I think with the new dentist it's going to be a little harder because they don't seem to be ready or willing, maybe the risk is too high and the payment's too low, so they don't really
Yeah.
see, um, that it could be beneficial, but it is
Mm.
scary. Endo is, you know what I mean? It's very tiny space. It's. I mean, I do it, but if I didn't have to, I wouldn't be upset.
Right, right. That's what everyone tells me. Everyone tells me that. It's just it's kind of scary because if younger doctors coming out don't want to do molar endo, like we have a specialist that's their whole day, is like molar endo.
Mhm. Mhm.
It's I don't know. It's why do we have to why do young doctors coming out have to be bottlenecked into that? There's other things that they could
Exactly.
get bottlenecked into. I don't know. There's such a
Yeah.
push for that
I
production.
Absolutely. I do feel that. I mean, we do hire without them having to do that though. Where
Mm,
I work right now, we don't hire on the basis of them doing that. But of course, like we'd love it. We have probably three, no, maybe four, like four doctors right now out of we have about 10 offices on Long Island. So maybe, four or five do molar endo. You know what I mean? But the rest of the
yeah.
offices don't really do it. So what's gonna happen? I guess I'm a younger dentist on the younger side as far as like I'm probably the youngest dentist still doing molar endo. So I don't know what's gonna happen. No one else is doing it, and I'm 45. So I don't know what's gonna happen like with our patients. I'm like, does that mean they're gonna have 20 teeth out a month? Because if I'm doing 20 root canals a month, like, are they gonna have 20 teeth out because they can't get the
Because they don't do mo
service? Is it right? I mean, yeah, but
good
it's
point.
not here nor there. Yeah.
Ah, no, that's a good point though. Like, where's it gonna go
I'm not
if that's the case?
sure. I'm not too sure because they, with even with like we have and I do my office is probably like 60% not straight Medicaid but DentaQuest. So with those patients, it's those are the ones who can't find endo. They're the
Mm,
DentaQuest. They can't find it. Medicaid, I have no idea. I'm not sure exactly. But I know when I was upstate, we took straight Medicaid and there was nobody really. So I did a lot of kids. There wasn't
mm.
really pedo up there. It's definitely a place that, they're going to need dentists, in that area, especially between Lake George and Canada. There's really like just a sprinkle.
Probably a handful, right? And that's like a
Yeah.
couple hours, no? In
Yeah. We
between
had, it's, yeah,
three
at
hours?
least like two, yeah, 2.5 or something to Montreal. And, we had patients actually coming for ortho because our guy like did ortho and they'd be coming from like hour and a half just to get their braces,
Wow.
because it's just not, so but it's a tough place to live. There's nobody really our age there. It's really
Mm,
either they're older with kids or it's just older in general. But when
yeah.
I was there, nobody was my age. Like there was no 30-year-olds really like that. But
Everyone's like old?
yeah, it was like older and I mean, don't get me wrong. Like some of the people were younger, but they had families. They had families, kids. There wasn't like many single people running around.
Oh,
Yeah,
sure. Yeah.
yeah. I used to frequent Outback a lot, and I remember this one time I went after work, and there was a dentist there, and he was saying I had a beautiful house. He's a general dentist. He had a beautiful house. He's probably like my age. I don't know. And he lived on the lake and all this stuff, right? But then he's saying how it was hard for him to find anybody. And I mean, not that I wasn't trying to talk to the guy or nothing like that, like romantically
Yeah.
or anything, but we were just kicking it as far as like just talking. And I'm thinking, oh my god, this guy makes probably like really good money, has like a house on the water, and he can't find someone else, because of where he lives.
Yeah.
So that's kind of the downside. Even though you're going to be busy up there because there's a lot of patients that need you, it'll be hard, for you to just socially to get, like to go out with people that are, more your age and stuff like that.
Yeah, people to hang out with, to connect with socially, grab a
Yeah.
drink with, go to dinner with, hang out with. Yeah.
So 5 years I was done. Five years I moved more south. Yeah.
So 5 years ago, or you were up for 5 years?
When I first started, it was 5 years. So, I stayed up there for five and then I moved down to Monroe, New York for five, which is near Harriman.
Okay. Okay.
Um,
Harriman. Yeah.
it's not far from the city. It's like an hour from the city. And then I was gonna work in Jersey, but I don't know. They kind of talked me out of it. They said the fees weren't the same, or And it was a brand new office. So the company was like, well, we're building a brand new office. Don't you want to work in a brand new office? And I'm like, well, yeah, I do kind of want to work in a brand new office. So I took it, and I've been there ever since. This is like my 6th year back on Long Island.
So
Hmm.
you've only been back for 6 years. How long were you up?
Yeah.
So you were upstate, and you got talked out of New Jersey. You never ended up
Yeah.
working in New Jersey.
No, no, no. The guy took me out to a real nice Tuscan Italian restaurant too, and he was really tried to get me to get that Jersey deal. But at the end
Yeah,
of the day, I was like, no, it had been 20 years. I think that was long enough to not be home, right?
yeah, yeah,
Yeah,
yeah.
I was like, no, my grandparents are here, all my family's here. My dad has a huge family that's here, so my mom's here, so it was good. It was time. It was time to come back. And like
So
you,
wait, let's
I'm gonna buy my mom's house, so I feel your struggle.
congratulations.
I guess it's 100 years old. I don't know how old your parents' house is,
You're
but
buying 100-year-old house? Seriously?
it's my great grandfather's house. So, my mother bought it back in 1998, but she was a single mom, so she didn't quite pay it off. So there's still that. So I made like a deal with her since she's taking care of her parents who are 92 in Port Jeff. I made a deal that I will fix the house up in exchange for mortgage. And
Look,
I don't know I don't know. Sometimes I'm like, maybe I just should have paid the mortgage because fixing the house is like, the bills are wild, but it is what it is.
they are the bills to fix houses are wild these days. You're not kidding. You are
Yeah.
not kidding.
No, no.
Especially Long Island, and then the mortgages is a lot. I think the interest rates are coming down though, so we might have a shot
Oh
there. But
yeah, yeah.
where did you grow up on Long Island? Let's
In
backtrack.
Port
Where'd you
Jeff.
grow up?
Oh
Port
yeah.
Jeff, right,
So
right. But now you're South Shore, right?
yeah, so Port Jefferson is where I grew up, and my grandmother, her parents have been here for a while, but my grandfather was a first generation Italian from Pennsylvania, so they met at Susquehanna University, and that was kind of their thing. They did live in Lindenhurst, which was kind of weird because I was like, oh, I'm working where they used to live, but which is kind of cool. But after Port Jeff, I ended up I played a lot of sports. My grandparents like put me into sports probably at like age 5. And
Wow, very
so
good.
yeah, probably like 5 to 26, I was going kind of hard. And Gatorade ruins your teeth. I'm just putting that out there. Gatorade will erode all your enamel off, drinking it that long. And I realized it in dental school that it was definitely the Gatorade that really thin my enamel. So like I have to, I get the whole cold thing. I really connect with patients that way, with the cold sensitivities and
Yeah.
with the grinding. I think athletes probably have the worst teeth. We just grind like crazy sometimes.
Oh,
But
all the time. All the time. Yeah.
yeah, Port Jeff was a unique experience. It was a small class. I mean, I think I had 70 maybe kids in the class or something like this.
That's pretty small. Yeah.
Yeah, it was pretty small, and I got to do it the whole time, kindergarten to graduating. But I don't want to talk too much, but my mom had me young, so she was like 18. So my grandparents helped
Mm,
out, and by the time she kind of settled in Baldwin, when I was about 13, 14, I did go to Baldwin and do like a tour and just saw like, okay, is this somewhere that I'd like to go? Sports was great, but
mm.
I'm already playing travel sports at this point in my athletic career in high school, so I felt like
And
that the
what
travel
sports, by
could
the way?
supplement. I did soccer, basketball, volleyball, but that was 6th grade. So that was like sixth,
Okay.
seventh, eighth. I
Okay.
did play volleyball, but then you got to pick, right? You got to like make a decision at some point, volleyball or softball maybe. But
Mm.
I had a few scholarships for soccer, like only a few, and then I had more scholarships for softball, but I didn't love softball. I just happened to be good at softball.
Mm.
So I
Mm.
ended up going to Howard for a scholarship for goalie.
Oh,
Yeah.
excellent. Did you play
Yeah.
there all 4 years? Did you keep up with it?
Yeah. No, I played all 4. Yeah. I mean, I was on full scholarship. I wasn't gonna give that up.
Yeah,
you know.
great. That's
Yeah. Yeah, I
fantastic.
wasn't gonna give that up. I wasn't gonna give that up. I was probably like number
And then
2, in our conference or whatever, as far as goalkeeping. But
that's outstanding.
we yeah, no, it was great. So that was awesome. But it was a good experience, to have friends right away, like when you go to school, to have that the group of girls basically that you could study with or hang out with, and things like this, at least on a collegiate level. I kind of felt bad sometimes for people who, when you're just coming in, right, and you have like a roommate and you're trying to like figure this whole thing out without the support so much. So I'm all
Right.
about student
Right.
athletes. I think it's a great way
Student athlete
if
is
you're
great.
able
I
to.
played basketball for a little while in college, and I noticed that too. It's the same thing, but also the
Mhm.
opposite for transfer students a lot of times, right? Because the cliques, those groups had already formed, and then if you
Sure.
transfer kind of like junior year, which is what I did with Steve, and then the cliques have already kind of formed, and then it's the friend groups are there. They all came in and spent 2 years together with each other already, and then
Mhm,
newcomers that are coming
mhm.
in third year, it doesn't quite click the same way. So I noticed that too. But it's nice when you come
Yeah.
into school and you have like that friend group where you can connect on common grounds. Like, all right, you want to go study in the library now? All right, let's go get something to eat. Let's go work out. That's
Yeah,
always
yeah, yeah, yeah. Absolutely, So I don't know, dentistry in general. I mean, when I went to school originally, it was pre-med. I was a chem major, biology major, chem minor. And I don't know, probably it was like my fourth year. This is just a funny story, but I took parasitology. I took a grad class, right, in parasitology because I was all into cellular biology and
mm,
molecular biology. That, I was like, well, I could always get a master's in this and like maybe work for some company or something. But, because optometry, I just felt like I wasn't sure. And then orthopedic surgery, as far as like,
you did not want to go
you know,
optometry. I can tell.
yeah, no, no, I didn't want to do it. But, the guy basically you have to inject the mice with different parasites, and you're supposed to study the blood and all this stuff, right? And the count and all this. But I was going to do it. Like I wasn't scared to do that stuff, but then it bit me, right? So I had to drop it. I dropped it when it bit me. And then like I got the mouse, right? And the guy was just kind of like, all right, you all right and everything. And then maybe like a week or so later, and I was doing good in his class. I was getting like A's, I was doing good. But he was like, maybe you should go talk to the dean in dentistry. Like maybe you need to go talk to Dr. Jeter, about dentistry. Have you ever thought about it? And I was like, huh, no, I haven't quite thought about that. Maybe, maybe I'll do it. I mean, the guy was an awesome teacher. But yeah, he definitely shied me away from lab. Like he's like, yeah, no, I think maybe we should have you do something else. And it was the best decision. I think I didn't realize the art in it, I guess. And I was an
The
artsy
art in
person.
Yeah. Oh, the art in
Yeah.
dentistry. You mean?
Yeah, yeah. I did
Yeah.
sculpture, ceramics, drawing, painting. I mean, I did all that in high school. I was just always into that type of stuff. So that was the easier part for me. But of course,
Mm,
the books don't change, right? And that was the
right.
academic part. I was like, oh boy. But I made
And
it.
then
I made it.
where'd you end up
Mhm.
going to dental school?
To Howard, I stayed. Yeah, because the professor was from Howard, and he knew the interim dean, like he knew the dean of admissions. So I think they were kind of
That's pretty
friends. They're
helpful.
probably recruiting. The recruitment, they were trying to kind of beef it up for Howard students to go
Mm.
to into dental school. Maybe we would have 10 from Howard that actually went to Howard Dental. So at that time, they were trying to beef it up, like trying to get more students interested. I think in it.
Yeah. What was the class size of Howard?
We started with 90, but after first year, I think we were knocked down to about 70, which was funny because it reminded me of high school again. I was like, oh man, I'm back. I'm back with like 70 kids. Yeah, I mean that's how it felt. But
Only 10 from Howard they would take to the dental school, though. I
well,
feel like
it's not
it should
that. I mean, they
probably be
wanted
more.
more. I think they
Mm.
wanted more students. We were actually the first class in I graduated 2008, but we were the first class to have half women. So that was
Oh,
kind of
wow.
the milestone of our class. And it was diverse. I mean, we had, all different kind of cultures. I mean, over 100 countries actually go to Howard. I think it's like 140 countries or something. So,
Oh,
it's
my.
a very diverse, especially when you get into professional school, there's more of a mix,
Yeah.
of students. But yeah, I mean, we still keep in contact. We haven't had, I mean, I went to my 5-year reunion, but I'm not gonna lie, like I didn't go to anything else.
You didn't
But
like
I,
it?
I keep
How
in
was that
contact
5 year
though.
reunion?
How was it?
Yeah, yeah.
I don't know. We went on a cruise. We did like a carnival cruise, and they put together where we could get CE. Like so, we took a CE class at one point, like on a Saturday, and then the rest of the time we were just hanging out. But I think the best part about it was Dr. Cox. She we went to Bahamas, but she had a fiance. Well, now they're married, but they were dating at the time, but he was, I guess, either from there or knew people there. So we had like a private
Hmm.
car and they drove us around. It was like four of us where we really got like a really nice experience of just the Bahamas. I would have never went to some of the places if like this person wasn't driving, because I wouldn't,
Yeah.
I don't know where to go, but
Oh,
yeah,
that's
that
super
was pretty
helpful. A
cool.
private
Yeah.
driver. Good for them. That
Right?
sounds like
That's
a
what I
really fun time.
So I gotta find a guy like this. Where I find this guy at?
Can I just
No.
call him whenever?
Yeah, I don't know. But hey, they're married now. They got kids. They're doing great. They're in Brooklyn. She's
Oh, not
private.
too
She got a
far.
private. Yeah, yeah, yeah. I don't know if I'll ever venture to private, but I don't know. I'm just
If you're comfortable, like there's no need to push for it, right? So
I mean, I feel like yeah, not too much. I think part of me feels like if my mom's house. The nice thing about it is once it's fixed, and let's say when I do want to retire, and we do end up selling the house, it'll be, I mean that'll definitely launch my retirement as far as helping out. Because I definitely feel like I don't know what's going on with the housing market, but it's kind of crazy, right? Like it's a little, it's good. It's like I don't know. Our
yeah,
house is worth like 700,000. I'm just like how, but I guess that's what they think if it's like fixed up, right? Like it'll be about
right.
worth about that. So I figure what
It
another
just keeps
20
going up.
years, right?
It just keeps
It'll,
going up. I'm not sure
it
where
keep up with the
what's gonna
million.
happen
I don't
to.
know
Yeah,
who's
there was a
moving
little
in
glitch
there.
there.
Yeah, I don't know who's moving in, but maybe maybe. Yeah, I don't know.
What do you think about having a smaller class size? Because I think 70 is like a good sweet spot for dental schools, especially. You need to get enough hands-on attention. You need to get a good one-on-one time to
100%. Yeah, I always felt supported. I always felt like the staff there and stuff would support you, and even as students, I felt like we would always help each other out if there was an issue with something or.
right.
I know even with the waxing, I don't you remember like having to wax up teeth. Did you guys had to do
All the
that,
time.
right? Yeah, I mean
Yes,
I
we had to
must have
do that a
sat
lot.
there till 5 in the morning, like waxing up people's teeth, like just helping them like wax their teeth up, to get them through the class because they wanted to be orthodontists. They really had no interest in like waxing this tooth up.
Yeah,
But like
yeah.
a couple students would be like, "Can you help me do that?" We would for sure. But we're running around with like camcorders. I mean, now it's just so different. You guys have just so much access to but we actually had to record in anatomy like the dissection and I was me and another guy would dissect the bodies that weren't finished and try to like get it up to par to for exam day. But we would have
Yeah,
to
yeah, yeah.
actually, yeah, we'd have to like record and then put it on like an MP3 and then share it with everybody. And it was so different. It was so different. Now we have
On
like
MP3, that's
pens.
crazy. Yeah,
Yeah, yeah, and then spread it around like so you can watch the video. It's
that's
definitely
crazy. Yeah,
different.
we did not have to do
Yeah.
any of that.
No,
Wow.
you don't do none of it. No, no. You got translating pens now. They'll translate, the whole lecture for you, like write the note. I mean, no, we didn't have that. We had someone really typing. They'd have to really type that up.
Oh man, yeah, we
So
had a guy at
different.
Stony Brook. Our class was 44. That class size. It was much
All
smaller.
right.
That's
That's
why I
yeah.
agree with that. With smaller classes, now they have classes up to 190. I know Tufts is in the
Real?
300s. NYU's 400. So that's why I'm like, it's nice to see smaller class sizes. You know what I mean? But
Yeah.
we had a guy for anatomy lab. He was like some PhD guy that all he did was dissect cadavers all day, and so he would
Hmm.
just go through like you said, like overnight,
Yeah.
and he would just
Yeah.
finish the job and everything.
Yeah. It was me, and actually the guy who did it with me. He's the oral surgeon now. But like me and him would just go in there and try to just make it just more presentable. Man, that
Do you
was
remember his name?
I don't miss it.
Where did he end up?
Man, I got to get his name. He's in Georgia though. I feel like he's in
Georgia.
Georgia. But I'll definitely shoot you his name. He actually just I feel bad I can't remember his name now. But he married a pedodontist in the same class and
Oh,
so he opened up his own like oral surgery facility, like a whole thing. I mean, it's very very awesome building. But I'll definitely shoot you his he just did that maybe last year, and she just opened up her own pedo. I want to say this year.
same building or separate?
I think it's a separate building, but I'm not 100% sure though. But they're doing their
Hmm.
thing. They're definitely doing their thing with that. Yeah.
That could definitely be a
Mhm.
great combination. I mean, every time the pediatric, patient comes after 15 to whatever age, whenever
Mhm.
the wasn't deemed ready, just refer it to your husband. That's Nice little gig.
Definitely. What do you think about what do you think about the Japan, growing teeth and stuff? What do you how do you feel about that? Or what do you think? I mean, it's going to be another 10, 20 years, I'm sure, probably before it's really available,
Yeah,
whatever the drug is.
exactly. I think 10, 20. Yeah, I think at least
Right.
probably 10, 20 years. They just got to be careful with the stem cells like that, right?
I
Because,
know. I'm telling
prevent
you.
cancer.
Mm-hmm. Mm-hmm. I
And
know.
then there's also, they're giving the injections in like the third molar sites so that wisdom teeth just don't develop at all. But it's,
I
you got to
heard
be
that
careful too.
too. I just read about that. I didn't even know they were doing that. I didn't even realize they were doing that. But
I
yeah, they want to
think you
just
just got to be careful.
stop
That's
the
going to
growth.
take a good 10, 20 years of research before we can actually put our foot down and say yes or no?
Yeah, I don't know if I'd want to be the first, to really do all that.
And then plus, like, if you're injecting something back there, you got the nerve right there too. What if that affects the nerve over there? What if that affects the development of sensation
Mhm.
of the V3 division?
I
Yeah,
don't know.
there's
What
so
if you
many things
squirt a
to
little in
ruin
a
it.
vein or something by accident? I mean,
Right, right, and then it goes through
is
your
that is
heart.
that
Who knows?
bad? Like, you know what I mean? Yeah. No, it's just like I got a lot of questions about that. And now they have
Ah,
nanobots. I don't know if you read that article, but they I don't know who's doing it. I meant to write that down, but they have nanobots that they have been using in mice that removed like 50% of the cholesterol. And they're like, yes, this could be permanently removal, like a 50%
yeah,
or but I'm like, how do you get them out of there? Like you just suck them out? Like do like a quick blood
there you
transfusion to
go.
kind of get them out? It's very interesting the way the science is going. It's
Yeah, that's interesting. Oh
maybe
man,
we'll
nano. I
be
don't know if I would use
we'll be like
nanobots.
80 years old. Like, yeah, put them in, put the nanobots in. I need another 5 years.
Put them in grow them in the bones.
Yeah, whatever it is. I mean, maybe by the time I'm 80, it'll be, perfected.
It'd be nice if that regrows like cartilage in the knees and
Oh,
stuff.
yeah, we need that. We need that. My grandpa never did it, and he ended up because he played football, he played softball and stuff like this for Susquehanna, and then his knees were
Mm,
shot. There was like no protection back then, but now that he's 92, I noticed like, man, if he would have got that knee, he'd be all right. He'd definitely be less pain, and your quality of life absolutely is much better when you're not when you're mobile. Let's just say that.
yeah,
You know.
yeah. That's
Yeah.
true. You got to stay mobile and stuff. You said he played sports. Did he stay active later
Mhm.
though, as much as he could up until his knees?
He did. Like he retired at 56, and so did my grandma. They were the generation, with GI Bill, and they really got a lot of perks from that.
Mm,
As far as like their first home, was very cheap compared to now. I mean, they always bought their cars cash, and well, they were a teacher, and my grandpa was an accountant for Grumman. It's not like they had like these huge salaries, but back then they could really stretch your money because of some of the perks they were given.
yeah, it used to go a lot further. What's the joke that you back in the day they would buy a house for like 19 blueberries? Those were
Something
the
like
days, right?
this.
When it went further,
Yeah.
when the money went so far, much farther.
No, now everybody got to work in the house. The kids got to work. We got to work. Everybody got to get working. Help support the help
We all got
support
to
the
be
family.
working. I like that you're buying. You said it's your mom's house because it was your great grandmother's house. Now it's your mom. And now it's going to be your. It's going to.
Yeah. So my grandmother's father owned that house. He was German, and his wife was Irish. He was there for a long time. I mean, they were there when those houses were first built after the war. Like all the houses looked the same. And then he
Oh,
went and put like he put a second floor attic, he built a balcony, and I guess the town just got together and helped each other back then. I don't know if he got like construction workers. I'm not sure how grandpa did this, but it's sturdy. It's that good wood, lots of the wood. You know what I noticed when I redid a room in there? I had did a window, and then for the frame, right? I put like whatever, like a wood for the frame, but because the wood now is so young, like it's like very young wood, the
mm,
heat. The heat that we have actually like warped the wood. Where that 100-year wood I removed, I mean that thing didn't budge. That thing stayed the same shape, the whole time on
yeah.
the windowsill. But this wood, it just like crumbles like under the heat, I guess. It just can't handle the heat. So the
Oh,
wood
really?
was better back then. I mean, they definitely, I guess the older the tree, the more rings, the more sturdier you know.
Yeah, I wonder if they treated it too with certain components or whatnot. Yeah.
Yeah, but
And that's in Port Jeff, right? Or was this Baldwin?
that's actually in Baldwin. Yeah, yeah, yeah. That's actually in Baldwin. And I mean, right now that I know I have younger stepbrothers who my mother adopted, well, sort of adopted later on in life. But they went to Baldwin, and basically I went to Port Jeff, and
Mhm.
but we still would get together like on the weekends and stuff like that. So I did grow up in the house, even though I wasn't there 24/7. So there was some. I mean, I'd love to keep it, as long as we could or can.
Yeah, yeah. So tell me more about like so you said you're doing a lot of endos. I wanted to hear more about like your transition
Mhm.
from upstate to down to Long Island now.
Oh
And
yeah.
now you're kind of in a similar area, right? The practice you said is Lindenhurst, but it says West Babylon, or it was West Babylon, now it's Lindenhurst.
Oh, it's so ridiculous. Yeah, it was West Bab, and I guess they just never wanted to quite change. For whatever reason, they never really changed it corporate wide to Lindenhurst. It's like only the
Hmm.
address is Lindenhurst, but they kept it West Babylon, maybe for religious. I don't know, for whatever reason they
Huh.
kept it like that. But I actually work in Bayshore as well. I've been in Bayshore for about 5 years, and I do 4 days a month. I was doing six, but the 4 days work. And I'm also working in Lynbrook. We had a dentist who had left, so basically I'm there just trying to keep it together for them until they really
Yeah.
can hire a new dentist.
A new dentist that does smaller.
Actually, the dentist there did no molar endo. She only did anterior premolar. So whoever goes in that practice, the patient's already used to not getting the service there, so it'd be a pretty easy transition.
I see. Okay.
Yeah, she just did like a heck of a lot of partials and dentures and things, and didn't, we got to get them completed. So now I'm just
Mm.
working on like just getting these cases completed, get people their teeth.
Yeah.
So that practice is a little different than where I work, as far as I do a lot bigger cases in Lindenhurst and Bayshore, due to just having the iTero, and we
Oh,
do have an AI program now that also helps with education with the patients and things like that. So I feel like that's helped a lot. Like I don't necessarily have to talk as much. I can just show pictures, and kind of we have basically they can get information and take it home with them and kind of read about what I've said. But
that's
I
pretty
do
useful.
feel like
Yeah.
the AI has helped in that aspect of patient education for sure.
You you have like an app, or what is it that you're giving to the patients where it kind of teaches the videos, the pictures, and you talk less? Is that AI or?
Yeah, so it basically reads, does read the X-rays. Eventually, we're like in transition right now, and I forget the exact name of the program, but it's, right now we're just using it for education purposes, but it is going to allow us, apparently, as we're using it, as each dentist is using it, it kind of gets used to how you treatment plan and things like this. So probably in a few months, it'll actually spit out a treatment plan that you can modify it and stuff like this. So you don't have to by hand put the treatment plan in, which is kind of nice.
Mm.
But I mean, we'll see. I'm not sure exactly how that part will work. I hope it's helpful and it's not more work, you know.
Yeah, I hope so. I also hope it doesn't kind of like put some of the treatment planning process in corporate hands because it needs to stay in dentist hands. But I just feel like
Yeah.
we're losing power
Well,
left and
they're
right.
gonna, what they're gonna use it more for is it's more like Big Brother. I kind of feel like a little bit, because if you do have an ethical dentist, you're gonna realize the AI is basically gonna kind of spit out maybe that they aren't doing root canals, or maybe that they're leaving decay until it's a root canal, right? Because
Mm.
there's some dentists who do that. They don't want to do fillings, so they'll just wait for decay to they'll just wait kind of until it needs root canal. But
Oh no.
it may help to just make dentists want to just be a little more ethical or more clinical orientated than money orientated.
Do you think that's going to be it? Because I feel like there's probably like little dials that they could increase or decrease in the back end, where it's like we want more production because that's all I hear with. Oh my god, like Dental 365
Yeah,
calling them at the end of the day, and they want to turn up the production dial, and I don't know.
no, so I mean, I'm gonna be honest, we do have a new group of people who are really, because I've been with them for 11 years. So this is probably the best group that we've had, right? And they're very clinically driven. So there's
Good.
things like I've wanted for years, like as far as our hygiene program, like I've wanted it to be a certain way for a very long time. And it was always a fight, because production, things like this. Now it's finally coming to fruition where, the way we should be practicing and thinking about the patient, things like this, I feel is much more. I think it's much more ethical, how they're running it now. Where there are some places though that are very much money. So
Yeah.
we're getting away with, we're getting kind of away from that and more, no, we want, like, I don't know, there was some person up in Massachusetts or something, and I guess there was a lot of like issues, and they actually changed the dentist, due to the issues that they were causing the patients. So I do feel that they are looking more like, all right, are they doing a good job? Like, are things looking good or not? Or
Yeah.
so I do feel like it'll be helpful in a sense, but at the same time, if you're doing big fillings like MODLs or something, they're going to ask, like you said, they'll probably be like, so why didn't we do a crown, or,
Mm.
things like that. And I think that gets a little funny because I know for me personally, I do see, probably half my patients really need to know how to brush and floss, just in general, just you need to know how to get in there. Right. And they just don't.
I like the
So
way you put
when
that. It's true.
they gotta know, but they don't. So sometimes like I have them brush in the mirror and there's bleeding everywhere, and I'm like, listen, you gotta come back in 2 weeks and I gotta see like what you look like, because if you're gonna keep looking like this, what am I doing crowns for, right? And what am I
Yeah.
doing big work for? So sometimes that is why I do a MOD or something, or some big filling, because the patient's oral hygiene is just not where it should be,
Mm.
where some dentists, they're gonna put the crowns, they're gonna do all this big work, but to me, like with raging bleeding gums, I don't deal with it. I just try to get them to where they need to be. Every once in a while, I'll temp crown it until they get better with their hygiene. I'll just do a temp crown. I'll be like, listen, we're going to monitor you for the next year and just see if you really are, going to keep up with it, and then we'll do a real crown.
Yeah.
And that seems to work. But and we have no fluoride here, so I think that's definitely why we see so much cavities, so many, so much decay.
You think
Um,
so? Yeah.
I think so. I mean, every once in a while, I do see fluorosis. I do see where patients have gotten too much, but I definitely feel. Um, I mean, we just see a lot. We see a lot of cavities. There's a lot of cavities.
Yeah. Do you
Big
think
treatment
like,
plans.
and would you think, like, honestly, thinking about that, actually, do you think if all patients like brushed, flossed every
Mhm.
day, the right regimen as necessary, do you think we would need would fluoride in the water be necessary? That's always a
I
question that I have, because
know.
it's going to be
So
different
I
for.
never liked it. Like I never liked it. Even in dental school, I was kind of like, I just felt that it shouldn't be something that I have to drink if I'm an adult and it's not going to help my teeth grow better. Like why
Yeah.
should I have to drink this? But I was for, if we're seeing kids and the baby teeth are coming in, or and we feel like they need that, okay, we could maybe prescribe it, right? Like the pediodontist could maybe prescribe a supplement or something if they feel it's going to help them, help it. And hopefully the supplement does not give them fluorosis though. You know what I mean? Like you hope they're monitored, right? Like,
Right. Right. But I feel like that's the thing. Like, if they're not monitored, then they're going to get cavities. But then if they're not monitored, they could just be popping a really good tasting fluoride. I don't know. It's, you know what I mean? It
and
could
maybe
be.
and maybe they're getting too much, because now it's in everything where they lowered the dose. I guess they lowered the parts per million that they're putting in the water,
Mm.
but now it's in everything. Your vegetables, your fruits. Because we're watering with fluoridated water. I think it's like almost 90% of the country is fluoridated. So I mean, we're getting it in other ways. I don't even know how much we need it with. I think the sugar really, and the sodas and the sports drinks. I mean, these kids love Red Bull. They love that stuff.
They do. Yeah.
And I think that does a lot, a lot to the teeth too.
And the soda, yeah. Kids with the
Yeah,
soda,
yeah,
drinking
the
the soda at
sodas.
such a young age, I'm
Mhm.
seeing. Oh,
Yeah, I wish parents realized that, if they really researched it with sugar in general, like the sooner you introduce your kids to sugar, they do say that they're more likely to do drugs when they're older because they're
Oh,
already
really?
getting that dopamine of sugar. So they're already getting that, like, rush and feeling good and everything. And they
Oh,
actually
wow.
say that the kids who really have to have sugar and things like this, they tend to have more issues with drugs when they're older.
Oh, wow. Wow.
Yeah.
I that's
Which,
yeah.
my grandma never really let me have sugar because my grandpa was like pre-diabetic. So we had like snack wells in the house. Like we never, we never had like real sugar in the house. So I grew up on like kicks and stuff. But my boyfriend, oh man, his dad was a chef and always had like those gallon tubs of ice cream and stuff. Oh, he's like a loves sugar, right? So I'm always like, I'm throwing out all the carbs. It's all going to the garbage, because I wanted to be
Gallon tubs of ice
healthy.
cream is dangerous.
Yeah, I started doing like free diabetic testing, like at my office. I'm like, anybody wants to know, like, I'll test you right now.
Did you really? How do you test that? What are you doing
I
for that?
just do
That's a
the
really
finger
good idea.
stick. I just do the finger stick, and we test it with the machine. And I mean, a lot of the time you're not getting a fasting one, but at least you're getting some idea where they're at. I think there's a
Yeah,
lot of people
blood
walking
pressure.
around with diabetes.
That don't have any idea, right? Yeah,
Yeah.
and high blood pressure.
Absolutely, absolutely. And I think like
Mm.
as dentists, we definitely as a general dentist, I feel like I absolutely see that patient more than their primary care. 100%. So
Oh yeah.
so why not get into it, right? Like why not be, taking their blood pressure and all this jazz
Well,
and
so
stuff, you
this
know?
is where I really like this. You know what I mean? And people they shy away from going to the dentist. They shy away from going to the primary care provider. But if you could get them
Mhm.
in either office and do the basic labs,
Yeah, basic
get the
stuff.
blood pressure. Let's check your finger stick. Let's see that could
Mhm.
go such a long way. How many times is it the first time they get a blood pressure reading in 10 years? And it's like, whoa, okay, you need to get some medication for this. And
Mhm.
a lot of these diagnoses, I mean, oral cancer too. That's not going to be your primary doctor's office, but that's us at the dentist office. And that's huge. I
Also,
diagnosed a
yeah.
patient 2, 3 weeks
What do
ago.
you feel about the HPV testing of saliva? Because I was working at one place and we were doing it and then we kind of stopped. But I guess it was because of all the like you're going to get some false positives or like maybe they'll be positive and then next year they'll be negative. So they felt like maybe we're freaking them out for no reason. But do you find value in that in testing like that or
Yeah, that's a great
you
question.
know,
I think that'll probably freak out the patients more than it would help because of the false positives,
right?
false negatives.
Right. It's like, oh, you're positive. Oh, you're negative. I don't know, but you know.
Yeah, because I mean, when does it actually start to cause an issue? It's when it like causes a lesion, or I
Hmm.
think right. That's from what I remember. I don't know. I just did a
Yeah,
biopsy today on
I
something that looked like
know.
HPV.
A few years back, men getting throat cancer, they actually surpassed women getting cervical cancer due to HPV.
Hmm.
And I felt like a lot of that was, probably, I mean, this is just my guess, is cigar smoking because, I feel more men probably might smoke cigars than women.
Yeah,
Because but yeah, I just thought that was interesting that, the men surpassed the women as far as that, you
that
know.
is very interesting, huh?
So
Yeah,
I do try to get I try to get them to go see the ENT if they are cigar smokers and things like this, just to get a
yeah.
baseline. And I kind of tell them, like, get a baseline now. So, if something does happen later on, they could probably highlight that area better, knowing how you looked healthy.
I think it's a great idea.
Yeah.
Preventative is always the way. Unfortunately, I don't. I'm still looking for healthcare today to go in that preventative direction, but
I
maybe one day.
know. No, no, that's like one of my big things is in St. Vincent. That's where my boyfriend's from. Is I'm really thinking about going back to get my master's in basically like hospital management kind of thing. And I
Yeah,
would I would like to in St. Vincent do like a preventive healthcare because they do have quite a few residents who do unfortunately pass away from very preventable things, diseases. And because the hospitals are so expensive, like sometimes they have to go to like St. Lucia and be like flown to St. Lucia and like these different places for specialty care. I mean, it's just like, I don't know, it's wild. He has a huge family like me. Like I have people who have died and things like this from preventable diseases just on Long Island. But for
yeah.
him, same thing. It's just not getting checked out. and just getting it early, could prevent some issues. So I would hope one day to do something like that. His
That would be nice. That would be really nice. I
yeah,
like
I'd,
that
I'd
idea.
like to. I think it would be a nice like kind of transition from dentistry to semi-retirement. Kind of running a clinic or something that is definitely government run. I wouldn't necessarily want to build one and things like this. I definitely would want subsidies from the government, to help with that.
Yeah, it needs some foundation there. You can't just be running that entirely on your own.
No, no, it's big. It's big. It's big. But yeah, one day, one day. But we just
You'll
try to
get
touch
there.
lives, right? Make them healthier.
One
Try
day
to
at a
get them
time,
healthier.
one patient
Yeah.
at a time, right?
Yeah.
Which days? You said you're in Bayshore 4 days a month now, so you're
Yeah.
usually
So
in
I
the nurse office,
do,
and then yeah.
yeah, I do every other Saturday, every other Tuesday.
Mm,
But I do feel, I would love to stop working Saturdays, but it still ends up being like a pretty good day. But
yeah,
part of me would love to give it up, just altogether. I'd like to, maybe just do like a Monday through Thursday, or a Tuesday to Friday or something,
I would love that Tuesday through
right?
Friday.
That would be nice, right? So yeah, eventually that would be that would be what I would like to do,
That'd
one
be
day,
so great.
one day, one day. But I mean, for now, let's see. I did partner with the company in 2020. I did do that. They did want me to
For
leave.
what do you
They,
mean
they,
you partnered with a company? Like what do you mean?
so they offered partnership in 2020. This was pretty much this was before COVID. I feel like
Mm,
this is before COVID. And I had just kind of come down to Long Island, and they were looking for people to want to partner, and you can get a percentage of basically the profit and things like this. But I just did it because I felt like I liked where I was. I mean, why not? They're offering it at that time. They were offering it really at no cost, which is amazing, right?
that is great. That's
But
great.
but now it's it is. I think it's like 40 grand or something like this. Over a
Mm,
2 year span, you can like buy into it. But I don't know if I'm ready for that commitment. But I'm happy to help out. I'm definitely happy to help out. But they did want me to leave and do administrative, but I didn't take the job because administrative doesn't pay as well, right? So if I'm
really?
like, yeah, if I'm like the regional and I'm helping these other offices, things like that, it just doesn't pay as well as being an actual doctor, because you're
Mm,
kind of maybe if I was retiring, I'd transition into something,
yeah.
like that, right?
But then you'd have to be like running around Long Island all the time. No?
Yeah.
That's
Yeah. And
back
the
and
guy,
forth.
but you know what? The guy now, he just FaceTimes. Like he'll do FaceTime with people, and kind of help them through that. Like he'll, try to conference with them. Because we do have quite a few offices.
So
Um,
you could knock off a couple in a day without the driving potentially.
yeah, 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 exactly, exactly. And I do help out with some of the younger dentists on Long Island. We have like a little chat group, and we're trying to do the CE. I'd really like to get them into that, like presenting every month and just talking and seeing how it is in their office and things like that. I
Oh, that's
do
such a good
do miss
idea.
that.
Yeah.
Yeah, I miss the camaraderie. I had that office upstate was great. There's so many people. I mean, you had
Mm.
four general dentists, the orthodontist, an oral surgeon, periodontist, endodontist. So that was just a cool experience to have all those people. My
Brings you back to the teen
residency,
days, right? Getting a
huh?
whole team in one place, right?
Yeah, yeah, that was. I mean, I miss it. We didn't have pedo, so I was doing a lot of kids, but I do miss.
Mm.
God bless pedo. That's all I gotta say. I do have a pedodontist now, though.
Amen
That
to that.
works. Yeah, God bless. I did watch Dr. Lee. That I saw his and I'm so with him. If you're just honest with people and just treat them right, I mean the money comes. You know what I mean? If you just gotta be a good person and have good bedside manner, and I feel like things just tend to fall into place. The only thing that gets me nervous about dentistry is the turnover of staff. I love my job, but the staff sometimes, like the turnover and the training. I know like some private dentists that some of them are doing like front desk and working because they've lost someone. I mean, I couldn't imagine you own this place and you're looking for another manager and then you got to train that manager, and so I know owning your own business is hard, and DSO could be hard too, but but at least you're not doing all the work, all the leg work, you know.
Yeah, yeah,
But you do miss out. You miss out on like 10-15% of the salary, I feel like, because you're having them manage the business, and you could keep more money obviously if you had your own write-offs and stuff, right?
right, right.
Yeah.
At least 10, 15, 20%. Yeah, the
Yeah.
write-offs also,
At
I mean,
least.
there's marketing, there's the business side of it that they're managing all of it. There's
Mhm.
the
Mhm.
materials, but the materials they just buy in bulk and then they get those discounts. So maybe not. They're definitely saving money there, but
Mhm.
you don't get that, like you said, if you're a practicing dentist, unless you own a handful or more of offices, you're not getting those buy in bulk Costco discounts.
I know, which is crazy. That's crazy. It
And it's
is.
little things like this that adds up between the insurance reimbursement, between the materials, between the implant costs,
Mhm.
between the
And
composite costs, between the
nothing
lab costs.
has like necessarily, DentaQuest has paid more over the years. I've noticed like we're getting better payout, but a lot of the PPOs and stuff, like I feel like it really hasn't changed much.
It's steady.
It's yeah, and that's really how it's so funny. I was so anti-corporate, and when I was in undergrad and stuff, like I was like, I will never, I will never work for corporate. I'll
It's me
never
right now.
do
Yeah.
it. Listen, but I mean, all in all, I mean, it's been good to me, but it's not for everybody. But at the same time, you just got to be careful who you're working for and stuff, and that you do have
Yeah.
autonomy over your patient. If you don't have autonomy and they're telling you what to do and stuff, it's just not the right place, right? Not the right
Right.
place.
That's corporate or private. If you can't do that, then that's
Yeah.
the problem, right? That's the number one problem.
And when it's so funny when my new dentist came, when she came on and stuff, I mean, maybe she's out like 3 years, something like this. And it was just so funny because when she first came, she's like, "You're just running this office like it's private, because like half my patients are DentaQuest." But I'm like, "Yeah, but this is what I do. Like this is what we're doing. We're treating everyone the same. Like like
Yeah.
we're just gonna, I'm not looking to I mean, I think I always felt that way, that I wanted everyone to have just a good experience, no matter the
Right.
insurance, no matter, right, what's happening. And maybe some of that is because, growing up, I did go to an all white school, right? So that was a little challenging. And I think just going through those challenges and being treated different and things, it just makes me feel like now as a provider, like I don't want my patients feeling like that. I want them to feel, no matter their insurance, that I'm treating everyone literally like the same, you know?
Absolutely.
And that's kind of how I do it. You know what I mean? I don't really look at insurance too much, but I mean it's important. You should be knowing what you're making. I'm not saying you should
Yeah.
discount it or anything, but
Oh, and let me
uh,
clarify that because like for
yeah.
listeners, just so they could understand that context. Like at All County, we do the same thing. We take a lot of dent quests
Mhm.
too. And by the way, I love seeing your referrals come in because I can always talk to them like, oh yeah, I know, I talked to them last week, kind of thing. But
Yeah.
with All County, it's the same thing. We can't look at the insurances, and I don't look prior to patient
Mhm.
care, right? But after, I think it's very important after the consult, for example, and then say
Mhm.
implanting a wisdom tooth, and it's a full bone impaction. That requires a certain amount of time, attention, technique, what have you. But when
Mhm.
they come back
Mhm.
and they deny it and they downgrade it to a partial
Oh,
bone
just
impaction, but it's covered in
drives.
bone, and I'm sure that's happening to you with how many
Yeah.
surfaces of filling, or like the crown, or whatever it may be. I I I think it's very important to look at that because it changes the reimbursement, but it's like, wait, I've required a certain amount of time, required a certain
Mhm.
amount of attention and detail to the surgery or procedure, and DentQuest is downgrading that to whatever they feel it was just because of an
Mhm.
X-ray. And so that just it frustrates me so much because that's very inappropriate for them to do. Or especially, have you ever gotten like
Especially
where a patient isn't in pain? What do you mean they're not in pain? You weren't there. Like,
Yeah, yeah, you have no idea. You have no idea. And to me, the narrative is everything. I mean, I do a lot of photographs. I take a lot of photographs for DentaQuest. I mean, all the time because I just know that at least with the photo and the X-ray, I just have a better chance. And we
yeah,
used to not get paid for core buildups with DentaQuest, and some magic. And you know what's so funny about DentaQuest though? I remember when it just used to be DentaQuest. That's all it was. It was just DentaQuest. Now there's like 10 DentaQuest under DentaQuest. Like I can't even keep it
yeah,
all together. It's like DentaQuest Emblem, DentaQuest, like I don't know. It's just there's so many branches of it, and they all have kind of like a different rule or a different thing. Some cover implant, some don't. Some cover the crown, not the implant. It's just a lot for my staff even to just keep everything together,
You
as
can't keep
far
up.
as it's like impossible, right?
You
It's
can't keep up. It's
overwhelming.
exactly what you're saying. Training the staff, and then they have the front desk, and then they upgrade from front desk to manager. But then that manager
Mhm.
leaves, and you're constantly training someone on an ever-changing insurance.
Yeah, 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 it's a rabbit hole for sure, man. You could go down that, you could go down
Yeah,
that.
yeah. But hey, at All County, I love seeing your referrals. We're all happy to work with. I was just with Dr. Barr today, so whenever you send something to the Melville officer,
Yeah.
he's also in Jericho. We love to work with you. And Dr. Chavkin, I don't know which insurances he takes because he's a different, I don't know, in the office, but because he's the boss man too. And
Okay, okay.
so yeah, I want to send a welcome to and thank you for working with
I
us as well.
know. And I think this is great that, you're really just talking with just dentists in the area and stuff like that, because it's Long Island isn't easy. I mean, I think for the specialists, and if you're in the niche, I mean, if they get into the niche of DQ, it can really supplement when your PPOs are not showing up. Or
Mm,
maybe you're not, like, we started to do ZocDoc, which I don't know. It's not quite helping as much as I thought. I thought maybe ZocDoc I could get more, just more of a mix of patients, just to kind of
yeah.
get a more, more better mix there. But it's only been a month or so. But I guess I'm hoping, just to have a better payer mix. But I know that for some reason right now, patients aren't necessarily coming in for the general
Mm,
dentist with PPO. And either that's because maybe because it's the holidays, but this
mm,
typically is like the busiest time of year. But this is kind of
right.
like the first year where it's really kind of lagged. And even some of my colleagues have said, like, it's just been kind of a ghost town a little bit. And some are wondering like how to pay their staff, like are they gonna have to dip into their savings to basically make up for who's not showing up? And but it's like a support group a little bit. But it was just interesting that they were talking about that. I thought it was just us, I don't know. I just thought maybe Long Islanders, we're busy doing other stuff. But
We are
I
busy.
don't
No, but
know.
that's a great point. I've heard from several people, and
Right?
even I know dentists in like Las Vegas, far away, and they've all said that this has been a very weird for patients coming in. The office, a lot of no
Mhm.
shows. I get a lot of no shows every
Mhm.
single day, cancellations the day before, 2 days before, and yeah, it's been very very frustrating. And
Yeah.
so is that just the first year? Because I just graduated residency 6 7 months
Mhm.
ago, so
I mean,
so
it
this is different.
typically was busy for me, but not lately. I mean, I
Hmm.
hopefully it picks up. I mean, I think the economy on Long Island, it's very business driven. I don't think people realize, but there's more businesses in Long Island, like square footage or whatever, than anywhere in the United States. So there's like more businesses lined up. So during COVID, we got hit hard. So a lot of patients that used to have insurance and stuff, I mean, we were kicking butt when we first opened up. And then it's
Hmm.
like, 6 months later, COVID hit. And maybe it took 3 years, I feel like, to really see the numbers
Get
again
going again.
go
Yeah.
up. Yeah, yeah. I mean, maybe we were doing, last year was a great year. I had a couple $90,000 months and stuff like that. But this year's been a little different. It's been a little
Hmm.
different. I
Yeah.
guess just not as many, I've done like big cases, I do like do full mouth rehab stuff like this, but it just I don't know why it's always ended DMO, but it's always like the edit DMOs that have like these full mouth rehab cases, and the reimbursement is just, man, but I do it because I want the practice. I want to keep doing it. I just, you know what I mean? It's like,
Yeah.
you're giving a great service to the patient. But it's like, man, one day I might have someone come in here and it'll be, woo, be a lot of work. It'd be worth it. You know what I mean? But yeah,
Yeah.
dentistry is. I was talking to a new grad yesterday. Well, actually, she applied to a bunch of schools, and
Mm.
she went to University of Maryland, and she's looking, just wanted to talk with me. It was a patient that given me her number, but she went to ortho. She wants to do ortho 100%. And I said,
Oh, I think I know who you're talking about. Is that Danielle?
no, this is Journey. Her name is Journey.
Journey.
Yeah,
Okay.
she just graduated. She's like waiting to hear back from schools and stuff. She really likes art and things like this. Like ortho's great, but I think I'm not sure how well they understand, like, but you're gonna have to do like real dentistry too, though. You got to get through those 4 years of like, doing fill-ins and stuff as much as.
Right.
So I hope it, I hope it works out for her. She did do some interning, like, with different specialists and stuff. So I said, well, that's great if you did that,
Mm. You
but,
got to
but
do
I,
that. Got to be exposure.
yeah, you gotta have exposure. And, oh, another thing about Long Island, too many dentists. There's too many dentists here. There's too many. There's like,
You think so? Yeah.
yeah, I think there's not an, it's, everyone is kind of, uh, fighting over the PPO patient, or fighting over the,
Sure.
you know what I mean? No one's fighting over DQ. So that put us in a niche where, like, yeah, like we're doing really well. Like as a dentist, I'm like the top 15%, as far as a general dentist, right? In New York, my check. That's why I'm staying with where I am. But it's,
Yeah. Yeah.
but at the same time, I do feel that I have a dentist like around the corner from me, and then, there's like one across the street. It's and then if you really look at the numbers, I mean, maybe, I don't know, what is there, like 800, I think it was, I mean, I really have to redo it. I'm really into statistics. I love that part of it, but I swear it was
Mm.
like maybe 1,000 patients for every dentist in Suffolk County, and then it was like 800 in Nassau or something. Like, it was ridiculous because there's just so many general dentists. So that's
Wow.
not enough to keep you busy, 1,000 people, right? You need more than that. So
That's not.
maybe as the dentists retire, maybe as people are retiring, and I don't know. I don't know.
I have a feeling that might be it because I'll tell you what, I only know like there's only one, two guys from my dental class, maybe three, four, five. We have 44 in the class.
Yeah.
Only one or two handfuls actually stayed on Long Island. Everyone else moved upstate, out of state, south. Um, Not too many, maybe a dozen of 44 that I
Mhm.
can name are in New York, on Long Island
Staying
still.
in the area.
Yeah,
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 it's,
a lot of
it's it's a
people
little
left.
rough. Yeah, it's a little rough. So I think that's some of the struggle for some of the private is that, you know, maybe
Yeah,
that's what
it has to do with
365 might be going through
yeah,
that
yeah,
too, right? And the smile list. I mean, they're really competing, with each other a little bit. And
right,
and I mean, we are too, but we see DQ, they don't see DQ. So we're kind of like in another ballpark. We kind of like make it up with that. But
right.
it's weird. I feel like with the 365, they do hold on to their dentists, but I feel like the hygiene turnover is high, and then the smilers is like the opposite. Like the dentists leave, but the hygienists stay. So it's just weird.
Huh,
Like I wonder what the dynamic is there, that they just have.
interesting.
Yeah, it's like a little opposite.
And I because that
Oh,
whole
have
phone
you? Well,
call
maybe
Canada
see,
thing.
maybe it's the other way around. It could be the other way around. Maybe 365 dentists are leaving, and the
But I know
smilers
hygienists
stay.
at
You know?
365 that aren't happy too. So
Yeah.
I know personally that yeah, they just nobody likes that phone
Yeah.
call at the end of the day or the day after. That's just like, well, why wasn't it? And why should anyone have to put up with that? That's just.
No, 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 no. You shouldn't have the
But
pressure like that. I never, I was lucky enough not to work somewhere where someone's over my shoulder just like pounding it
mm,
out, like you need to be
got it.
doing this or that, or it was never about that. It was more about like, what do you need, to do your job better? And I'm definitely for that,
Right. And
definitely
that's
for
what it's all
that.
about, right? So,
Yeah, 100%,
Dr.
man.
Noy, thank you so much for coming on today. I gotta get going right now, but thank
I
you for doing this.
know. We got
We'll
to
have
get
a part two.
home. Yeah, we got to get home. But I enjoyed this. Maybe later, in the future, we get on again. We'll have some other things to talk about.
We will. We will. I wanna
Yeah.
bring something. When are you in the office? Are you in the office tomorrow?
Yeah, right now I'm doing 6 and 5. I'm working 6 days, 5 days, 6 days, 5 days. I know.
Tomorrow too?
It's
Christmas Eve?
yeah, I only have the day off. I got the day off, and then I got New Year's Day off. Besides that, I'm working. I am. I'm
I'm
putting
on
it
the
in.
same thing. I'm on the same grind. Yeah. One of
and
these
and I
days I
got the
want to bring.
nerve. I'm coaching PAL basketball, right? So now I'm like, okay, like I'm not working enough, but like let me do this too. But it's awesome. It's awesome. I'm coaching like third, fourth graders, and I just wanted to do something. I used to be a Rotarian when I was in Monroe for like 5 years, and I miss doing that, but I miss actually. Working in the community, not so much like meeting in the morning at 8 o'clock to talk for an hour. Like I actually
Right.
want to like go
Right.
do something. You know what I mean? So PAL is
Yeah.
great because you get to like talk to these kids and really like, I got two girls on my team, so and I don't think they've ever had a really like a girl coach before. So with PAL, so that's pretty cool. And guess
Oh,
what?
that's great.
Baldwin is like fourth in New York State, like for the women or something, like the basketball team.
Oh, they didn't
Like,
they? Oh no, that was North Babylon when they had what's her name? Actually, I think wasn't her last name Baldwin. She went to UConn.
yeah, 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 yeah. I remember that. I remember that story.
Good girl basketball players come from Long Island.
Yeah, yeah. So I'm excited. It's not it was always like my intermediate sport, but my
Hmm.
boyfriend's daughter is really into it. So I felt like I need to do a refresher. So this was a great way to so at least I can act like I know what I'm talking about.
Oh my gosh, that's so good for
Yeah.
them too that you're doing that, and then to see a professional come out and like support someone
Mhm.
in the team aspect of sports. Because I mean, you remember dental school; it wasn't always
Mhm.
a team environment. We need
Oh,
to
no.
we need to keep that
No.
going. The leadership.
Yeah, that I was telling the girl that too. I said, I always studied with like the smartest people in class, like I really did. But at the end of the day, I said, don't expect them to share everything because they're not. They're really about that grade. Like if they're kind of afraid if they share with you, you might get that one answer right, and I mean,
Mm.
it's that serious when it comes down to the last few years. You really, you know, but uh,
It
but I
doesn't have
always
to
did
be.
anyway.
The rising tide raises all ships, right? So,
Mhm, 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 mhm.
but
Yeah, yeah. But that was
okay,
awesome.
no, I
You
will.
gotta get yeah. What's up?
Yeah, I was gonna say I'm gonna bring down. I want to bring you some treats one of these days. I don't think I'm gonna hit you before Christmas, but maybe if I can next week, I want to stop by the office
Yeah.
and say hello.
I'm usually there. I'm always there on Wednesday. That's like the one day I'm like always there. I'm always there on
Wednesday.
Wednesdays. I'm usually there also on Thursdays. Right now I'm only doing Friday, every other Monday, every other Tuesday in Lynbrook. So yeah,
Okay.
Wednesday, Thursday I'm there. I'm at in West Bab. Yeah.
So maybe I'll hit. I might be
Hmm.
able to hit it next Wednesday is gonna be tough. So maybe 2 Wednesdays. I'll aim for
Yeah,
that.
yeah, no sweat, man. Whenever, but definitely hit me up so I could spend, I could chat with you a little bit when you
I
get
will. Yeah.
there. Just feel like hi and bye.
Sometimes that's how it feels sometimes because it's at the end of the day when I finally kind of rush out of the office and get somewhere, and then it's like, here's some donuts.
At least give you a
Maybe
high
I'll see you
five,
later.
something, man. I'll give you a dap or something. But I get
But
that. I get that. Yeah. But
it's
we're gonna be
fine.
all right. I'm looking forward to, like I said, I'm trying to get that better payer mix. I really do wanna, do some bigger cases and I would love to shoot some to you.
Hey,
Um,
you want to do bigger cases? I've been trying
yeah.
to get some all in X's going. Whatever you want to do, however we can do it, just let
Yep.
me know. Anything I can help you out too. You know what I mean? I got to pick up cards too because patients in the office when they're
Yeah,
looking for
yeah,
dentists in the,
definitely. Yeah.
all the time. I'm getting this I'm getting it multiple times a week. So that could
Yeah,
be
because like I said, like I have an oral surgeon, but he's only there once a month. So it's very
mm,
hard to, sometimes do bigger stuff, it's sometimes a little harder, to get
that's
them
fine.
in.
That's
And
not. Yeah.
yeah, yeah, yeah. Yeah, he's
So is that
travels.
something for dating
I don't know
too,
if you know
or
Dr. Anwan. I think he did Montefiore. I'm not sure like where he
not
did
sure either?
his thing though, but he's about 7 foot. He's a big guy.
Oh
Very
no,
nice. Yeah, very
I
nice.
don't know who that is. Then no.
Yeah, yeah, yeah. Very nice guy. Very, very quiet. But like, lately I've been working on days he works, so we're chatting it up a little more. A little bit. But I ain't gonna forget about you, Brendan. I ain't gonna forget about you. I'm gonna definitely send you some people.
Yeah, we'll work on it. We'll work on it. We'll do that
Yeah,
together. So,
yeah, definitely.
all
But
right, Dr. Mo, you have a good
okay,
night.
man. You too. Thank you
Merry
for inviting
Christmas.
me.
Thanks for coming on.
Yeah, this was great.
All right, well, we'll talk soon. Just if you can give it like 5, 10 seconds, you'll see there's like a line that says uploaded
Oh yeah,
100%,
sure.
and then we're good to
I
go.
see. I got you. All right. We're uploading. Edit anything you want out. It's okay.
I think we're gonna keep all this.
Oh, good. All right. Let's rock on,
Yeah.
man.
Oh yeah.
Yeah, yeah.
All right.
Absolutely.
You have a good night and Merry Christmas again.
Merry Christmas. Happy New Year. 2026. We're gonna get 2026.
We got this. We
All
got
right.
this. All right. Good night.
Good night.